Okay, so for diagnostic testing, this is chapter 45, and this is the micro lecture that's going to correlate with that. So what we're talking about here is quality control and quality assurance. So it's QA and QC. These are important to the integrity of diagnostic test results. Quality controls in the facility that you're going to be working in are going to be done at the beginning of each shift, at the beginning of each day. Do not open a new bottle of reagent strips until you've completely used an old bottle. Same with any new test kits for quality control. There will normally be a quality control log that you will have to initial every day. Everybody will do it, or sometimes one person is assigned to it, but usually there's one MA that is assigned to QC and QA, monthly, weekly, daily. There's logs for everything at the facility that you're going to be working at. Quality control, everything that's to be documented in the logbook is following: the date, a patient's name, test performed, results of the test, your initials, any kit reagent strips, lot numbers, expiration dates, and then the QC results. So there's usually going to be a book. It could be a digital book, or it can be a manual if it's issued by the state, if it's a mandated federal immunization program for federally covered insurances, if it's Medicaid. They all have their own modalities for QC. So please be aware of your facility's protocols. When we're testing the hemoglobin, remember, hemoglobin is essential to oxygen circulation in the body. The normal ranges are listed here. Usually it's between 13 to 17 grams, and for females it's 12 to 16 grams or deciliters. Hemoglobin is the component of your blood that carries oxygen, okay? It's the hemoglobin protein which the iron molecules bind to. So if you have poor circulation, your hemoglobin will be affected. So it's not so much that it's a sugar or a diagnostic test for diabetes as it is a circulation issue to see how much oxygenation is getting to the cells at the cellular level. This is a good anemia screen. If you have low iron, a hematocrit is the percentage of packed cells. So there's a methodology to determine hematocrit. Hemoglobin and hematocrit are always tested together. One says HGB and the other one is HCT. That gives a provider very good clinical diagnostic data. If you have a CBC and part of that component is the indices of the iron, if the hemoglobin and hematocrit ranges are low, sometimes a doctor will then order secondary diagnostic tests. One of those tests is a ferritin level, and another one that's commonly ordered if these ranges are out of whack would be a TIBC, which is total iron binding capacity. And that shows exactly how much oxygen is binding to your hemoglobin at a cellular level. So it's a pretty cool test. Complete blood counts, or CBCs, they are always run on a lavender EDTA top. That's ethylene diamine tetraacetic acid. You should know the additives that are in each of these tubes that you're going to be drawing and what they do. Okay, so in the example of EDTA lavender top, purple top tube, this is what keeps your blood in the same homeostatic stasis it is while it's in your bloodstream. Okay, it does not induce coagulation or clotting. What are some of the indices and the analytes that are in a complete blood count, commonly known as a CBC? It's a very routine blood work order. It can tell a lot of things. It can tell a physician or a provider your total RBCs, the total white blood counts, your platelets, hemoglobin, and hematocrit. Why are those all important? Okay, well, your red blood cell count, if you have an overabundance of them, you could have all kinds of diseases. You could have hemochromatosis. It could have all different types of issues with wacky RBC counts. Sometimes the red blood cells are actually, they look at the morphology. So if the red blood cells are not biconcave, that could be a problem. Your total white cell count. Obviously, if you have a very high elevated white cell count and your total lymphocytes and monocytes are elevated, that would clinically indicate a presence of an infectious pathogen or some type of systemic inflammatory infection agent in your body. And your platelet count. Platelets are important because they are what starts and stimulates the clotting process so you don't bleed to death. So if there is a discrepancy in the shape of a platelet, which are called thrombocytes, if they are not shaped correctly, if they can have, there could be reason, could be clinically significant. If you have a low platelet count, you may not be able to have a surgery because that would indicate that you would have a longer healing time and you may not clot properly. So just the act of surgery in itself could become life-threatening to somebody that has a platelet disorder. And then they're checking the hemoglobin and the hematocrit together because they want to see what the percentage of those lymphocytes and monocytes are. So again, the ratio to the white blood cells to the red blood cells can give a lot of clinical data to a provider. And again, the hematocrit is how much oxygen is actually binding to those cells, how much percentage of packed oxygen can be inside the red blood cells. So those are really important. Some of the, what we call a differential, okay? This is a count that differentiates different types in a sample, okay? So we would call it a peripheral smear, and on that smear is a grid, okay? So what we're counting is 100 type white blood cells on a differential smear. That's why it's called a differential. It differentiates the types of cells in the representative sample on a grid under a microscope or an analyzer. It's looking for the numbers of the neutrophils, eosinophils, the basophils, monocytes, lymphocytes that are counted. Then a technician will review slides for abnormalities of the cells. Okay, so that's when they will be clinically indicated if they are below or above range. MAs don't perform these counts, but you should be familiar with the reporting for this. This is done by lab techs inside the laboratory. In case a patient asks you. So again, patient education is going to be very important going forward. Another test that you'll be familiar with is the ESR, what we call, that's the shorthand for erythrocyte sedimentation rate. That's the rate at which red blood cells will settle into a calibrated tube within a given time. What that can do is it can determine an inflammation response and your inflammation markers. So there's the Westrogen and the Wintrobe. Most times people will do the Westrogen. I haven't seen too many places in the continental US that really do the Wintrobe testing. Most of them are the Westrogen. Glucose testing is a point of care test, POC. It measures capillary blood, so it's not using venous blood as we would use in a venipuncture. It's just a handheld meter, and it's got those reagent slips or strips. There's tons of types, okay? So it just depends on what kind of preference your facility has. But make sure you read the owner operator manual before you go ham and start stabbing people and doing capillary punctures. Each one of these meters comes with their own reagent strips, and they will have to be QC'd in their own specific way. So just make sure you read those manufacturing protocols. A glucose tolerance test is performed with patients that have consistently high, what we call FBS, which is fasting blood sugar. This test is ordered for diagnostic purposes for diabetes mellitus type 2, usually, hypo or hyperglycemia. It can also be used for gestational diabetes. Sometimes it's incorporated into the obstetric panels when you become newly pregnant. This determines the patient's ability to metabolize a high glucose load within a prescribed amount of time. You may have to administer at your facility the glucola, which is like an orange drink. It is highly concentrated, easily digestible, fast acting, very concentrated glucose. Okay, so it will, at a fasting baseline, your glucose will be measured after you consume a prescribed amount. And then it's like an all day kind of a thing, but you will stay, and every couple hours you'll be tested. Then they'll tell you to go eat, come back, and then they'll test it again. So it's not fun. The drink is gross, but there's a whole procedure to that, and that is to determine if you have a glucose intolerance and your body's not metabolizing it correctly. Glycated hemoglobin A1C. Okay, this is its own special thing. This is a modified form of a hemoglobin that is elevated when blood glucose levels remain high. Okay, that's why it's called glycated. This is a capillary puncture. You can also do this on a lavender top. A lot of doctors like to order this as a serum test diagnostically through Quest. And it's always in a lavender top. So it can be added on to the same lavender top that they're going to use for the complete blood count, but it has to be ordered separately, but they can go on the same sample. But this is to determine how a diabetic patient has been controlling their blood sugar, and it gives you kind of a glucose snapshot over about 60 to 90 days. So these are usually ordered every 90 days. A lot of these are standing orders if a patient has really unregulated diabetes or it's very hard to control. But it's often ordered with random blood sugar levels. Now, this is just another panel they will order as part of like a routine lab workup usually. Cholesterol testing. Now, in the field, this is lipid testing. We call it lipid. It's a blood fat. Cholesterol is a steroid, actually, and it's normally found in the body. It occurs naturally. But any kind of levels that you get over 200 milligrams in your blood, in your serum blood, can cause atherosclerosis and arteriosclerosis, which is hardening of the arterial walls. It can cause cardiovascular incidents if it's not dealt with. There are CLIA-wave tests that are available. There's a lot of them now coming online that are point of care testing, and they are just as effective, but a lot of providers just still like that serology, fasting lipid testing, an FLP, fasting lipid profile, where you are instructing your patients to fast 12 hours. Water is okay, medications are okay. They're absolutely allowed to brush their teeth. Please tell them that. There will be people that haven't brushed their teeth in 24 hours, coming all up in your face. Let them know ahead of time. You may brush your teeth. You may have and consume as much water as you would like. NPO fasting is different than fasting for a cholesterol test. Sorry, my dog is a monster. Okay, so tests should be collected as fasting. Nowadays, the analyzers down in the lab, they're multi-million-dollar machines. They can ascertain whether or not you've been fasting. If a patient hasn't fasted, you can determine whether the doctor that is ordering that is going to lose his mind or lose their mind. It's the provider's call, but the lab can actually deduct 60 points off of that total cholesterol number to give a more adequate fasting level. But anything above 200 milligrams is considered potentially cardiovascular risk. So these are usually always done for like your annual wellness visits. Doctors just like to do these just to determine where you are as a cardiovascular risk. Immunology is the study of the body's ability to prevent and fight off infections. So immunoassays are diagnostic tests that will measure the amounts of antigens, which are created as a response to an infectious pathogen, and then antibodies, which are the reaction to the antigen. So antigens produce antibodies. So you can have an IgG and IgA tests. So one will determine exposure, one will determine immunity. So know the difference between an antigen response and an antibody response. Okay, so we'll pick up again where we left off, and we'll continue on PowerPoint number 15 coming up. Thanks for watching.